Leading up to Guideline A, we find the following general instruction for principal diagnosis assignment. In determining principal diagnosis, coding conventions in the ICD-10-CM, the tabular list, and alphabetic index take precedence over these official coding guidelines. In other words, if there is a conflict between the guidelines in Section 2 and the instructions in the tabular alphabetic index or the coding conventions, we must drop the principal diagnosis guideline in favor of all these other rules. For example, we have a patient who is admitted for liver failure due to accidental consumption of death cap mushroom. All treatment was provided for this condition only. The reason for admission after study is definitely the liver failure. This is what buys the hospital bed. This is what the patient is getting treated for. But the problem arises when we start coding for this case. Hepatic failure due to drugs codes to K7110. And yes, we have a mushroom here and not a drug, but as you can see, it's still the correct category as K71 describes toxic liver disease. Is this the principal diagnosis then? Unfortunately, no, because notice this instruction we have under the category header. Code first poisoning due to drug or toxin if applicable. Because our patient consumed a noxious mushroom, this is applicable to our case, and we have no choice but to overwrite the principal diagnosis guidelines and assign the T code first in order to comply with tabular list instructions. Another example could be a patient suffering from Parkinson's dementia who is admitted for violent and disturbed behavior. Although all the treatment will be directed at the behavioral disturbance, it will still not become the principal diagnosis because the index is using the etiology and manifestation convention, these brackets, to instruct us how to code this case. We must sequence G3183 first, and only then can we code F0281. So again, the principal diagnosis coding guidelines get overwritten by conventions or the index. Now let's see those guidelines real quick.